Hello out there and welcome to Public Conscience. You are on to the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society organization working to promote good governance, participation, and accountability in Nigeria. I am Chidozie Obonnaya with my colleague Adaobi Obiabomo.
A warm welcome to the program, wherever you are listening to us.
On Public Conscience, we seek to evolve a corruption-free society through the amplification of investigative corruption stories by our partner media organizations and by alerting citizens and the government to their democratic actions against it. We equally promote integrity by amplifying rare cases of the display of honesty by public and private individuals in the course of their normal activities. We appreciate the MacArthur Foundation for supporting the production of this program.
Today, our focus is on Nigeria's healthcare delivery system, especially on how issues of staffing and inadequate manpower continue to limit the potential of primary healthcare centers across the country.
It is said that health is wealth. Therefore, we have devoted some episodes of this program to bringing you a series of reports on the challenges of the health system in Nigeria. We are collaborating with the International Center for Investigative Reporting, ICIR, which has put together a compendium of investigations exposing how corruption, negligence, staffing, and manpower-related issues, among others, worsen healthcare delivery in Nigeria.
The spotlight today is on the investigation in Anambra primary healthcare centers, which has exposed how understaffing is ruining maternal and infant healthcare delivery. Similarly, in Nasarawa, employees at the health centers are either contract staff or volunteer community who earn between 3 to 10,000 monthly. And the story is not different in Ogun, as the shortage of personnel remains a major challenge, and some cases, doctors, nurses, and midwives are very few in number.
Today's program seeks to remind government at all levels that special attention needs to be paid to primary healthcare centers to tackle the problem of inadequate manpower, which has given rise to quackery and extortion of citizens by health workers. For you out there, do you know that primary healthcare centers are meant to play a vital role in the health system, but are now facing sabotage? What is your impression when assessing primary healthcare centers near you? Do you see enough health workers out there? What do you think must be done to improve the quality and number of health workers in our primary health centers across the country? And also, what do you think must be done for Nigerians to start getting the right value for money spent on primary healthcare centers?
Be ready to join us through phone and text messages during this conversation. The WhatsApp phone line to send your message to is 0902 265 6167. That is 0902 265 6167. Please indicate your name and your location when sending your message. Remember that this number is for messages only. If you just joined us, we are looking at an investigative report by the International Center for Investigative Reporting, ICIR, on how the lack of manpower and staffing issues are crippling primary healthcare centers in Anambra, Nasarawa, and Ogun states.
In 2021, the World Health Organization's health system ranking placed Nigeria at 163 position out of 191 countries. The federal government flagged off the primary healthcare center revitalization program in January 2017, under which it's committed to refurbishing 10,000 primary healthcare centers across the country, with at least one center in each of the Nigeria's 109 senatorial districts.
A 2021 study shows that the current state of the primary healthcare system in Nigeria is appalling, with only about 20% of the over 30,000 primary healthcare facilities across Nigeria working. And joining us to further this conversation is an investigative journalist with the International Center for Investigative Reporting, ICIR, Marcus Fatomale. You're welcome to the program.
Marcus, you're welcome.
Joining Marcus in the studio is Olaniyi Olaleye, who is a program officer at the International Budget Partnership. You're welcome to today's episode of the program also.
All right, gentlemen, I must welcome you also for joining us this morning. But let's start this conversation with Marcus. Marcus, let me start by commending your organization, the ICR, for going out there to, investigate all this. But give us a background of your report, which focus on the lack of health workers and the staffing challenges out there at the PSCs.
Okay, thank you. Nigerians, this is a great opportunity to brief you on the works that the ICR has been doing in partnership with the International Project Partnership. These report investigations took place in 12 states in Nigeria. So, the states are Nasarawa, Niger, Bauchi, Gombe, Kano, Jigawa, Anambra, Cross River, Akwa Ibom, Ogun, and Oyo states. So we assign reporters to those states, and we found that there were a lot of issues, just like you rightly mentioned: inadequate staff, poor welfare packages, dilapidated structures, and general apathy, even from the public, because they've lost confidence in these centers. In many of these centers, they are not functioning. But we also discovered that the Basic Care Provision Fund is really helping to some extent in some of the states. But the major issue has been the midwife service scheme, which we found out to be no more functioning, inexistent. So that is where the real problem is. If the Basic Care Provision Fund is working, the government is committing funds to those PACs, and there are no workers at the PACs to make use of the funds, then there will be no results. So, like for instance, when I was in Nasarawa State, in the whole of Nasarawa State, I visited 17 PACs in 5 local governments comprising Obi, Kokona, Toto, Lafia, and Wamba. In all the 17 PACs that I visited, there was no nurse. And
no nurse.
There was no nurse in all the 17 PACs. No nurse. There were only 8 midwives in the 17 PACs that I visited. Only 8 midwives. And out of the 8 midwives, maybe 4 were contracted, meaning that the government was not paying them. So they were collecting like 5,000, 10,000 naira monthly. That's what they earn monthly.
Are they skilled?
Those
are they trained midwives?
Yes, they are trained midwives. They went to the school of midwifery, maybe in Gombe, in Nasarawa, wherever, and they were recruited. So those midwives were trained. But some of them, like half of the 8 that I met, were contracted. And they were earning like 10,000 a month. And those that are on the government payroll earn from 60,000 naira upward. So those that were newly recruited. So those are some of the challenges that I met on ground. And the same, you should see the reports in Anambra. It's the same problem. The government in Anambra engaged 67 midwives. And because of the stoppage of the Basic Care Provision Fund to the facilities, they couldn't pay. So those are some of the challenges that...
Okay. Let's also, touch on those places, expand on what your findings a little bit. Okay. You've talked about what you saw in Nasarawa, Ogun, Anambra. What more can you say?
Okay, now I want to point out some of the PACs. The PACs, for instance, like in Nasarawa, these PACs are grouped into 3. There is the ones that are called the clinic. So those ones are in the remote communities. Then you have the basic PAC. They are also called PAC. So people know them as PAC and they are called PAC. Then you also have the model. So the model PAC, you have one, at least one in each local government. So those ones are big. And no matter the size of those PACs, you still discover that community health extension workers manage them. There is no, maybe like three PACs that I visited that you see a midwife managing. Community health extension workers are the officers in charge. Their junior health extension workers are supporting staff. you see cleaner, you see gate man assisting in labor room. You understand?
Yes.
And you see many of the buildings are dilapidated, except the only places where you see PACs functioning are those with basic healthcare provision fund, because of the fund they get. Like in Nasarawa now, Nasarawa gets 1,200 naira per enrollee. So if you have 200 enrollee, you multiply that by 1,200. That is how much you get monthly. The government is paying that as at when due in all the PACs that I visited.
What was the coverage? Like, how many PSCs did you visit in Nasarawa?
I said 17.
17. What of Anambra?
Anambra, there were about 30 PACs.
30
I wasn't the one in Anambra.
Okay, your colleague. Yeah.
Yes, the journalist, the reporter in Nasarawa, in Anambra visited 30 PACs.
Okay.
And it is the situation is the same. Like in Anambra, for instance, they studied in Anambra between January and June this year. 20 women lost their lives. Why delivery? Why put it to bed? Why? Because if you read the report, you discover that when these people come to the facility, they don't meet the workers. They don't stay in those communities. They prefer living in the cities. If you read the Anambra report, you discover that when somebody is coming to the PAC, you have to inform the gate man. It's the gate man that will be calling the nurse in those places. I'll find this that in the south, you have nurses, like in my state now. Because I was shocked when I got to Nasarawa. In my state where I came from, you see nurses at PACs, you see midwives.
Your state is?
Ondo State.
Okay.
So, when you are coming to a facility like in Nasarawa and Ogun, you have to inform the gate man that you are coming. The gate man will be calling the nurse or the midwife on duty that, please come and attend to this person. And in the whole of about 20 PACs in this report, there were only 7 deaths within 6 months. How could that happen in the 21st century in a state? 20 PACs, only 7 babies were delivered.
Marcus, let me jump in there. You have established that there's understaffing.
Yes.
We have contract staff, workers, and you also have volunteers. How is corruption playing up in all of this at the PHCs as a result of the poor staffing and facilities?
Yes.
Are there issues of abate extortion? Are there issues of diversion of drugs?
You definitely that must happen. We couldn't actually pinpoint actual location, but from experience, I've been in Abuja here for 12 years. When you see a nurse working maybe in a general hospital, even a private facility, and that person is offering services at home, you see that person dispensing drugs, you see that person giving injection. And this also happens also in Nasarawa and in other states. Those working at the government health facilities, they render services at home. So definitely that must actually occur.
So the possibility is
very
high.
Very high, because when they go, for instance, like those facilities, I accept Nasarawa because the other state, I said it earlier that wherever the basic care provision for services are available, services are better. But our findings also in Nasarawa and Ogun show that there were still absenteeism among the workforce. There was absenteeism among the workforce.
Who looks after the PSCs at that level and at the community level is very, very key, and we'll come back to you to get that from you. But it's a good place to bring in Niyi to join us, or Olaniyi Olaleye to join us.
The program officer at the International Budget Partnership. Niyi, how would you react to the investigation, considering that primary healthcare centers are the baseline for healthcare? What do you make of the management and impact of PHCs in Nigeria over the years?
So I think it's a good way to start, and I like the fact that he has actually given some of the investigative journalism that ICR have done. And but for me, I think all this issue we have to trace it from the background and see how the Nigerian system has actually been prioritizing the health system in Nigeria. And if we look at the trend of things from, let's say from 2015 to 2021, you will see that the Nigerian budget over the last 5 or 6 years has actually not met the Abuja Declaration, which the African countries, of which Nigeria was among, committed to allocate at least 15% of their budget to the healthcare. So that's the roots of the causes of all these problems we have in the healthcare service delivery. So if you have committed that you are going to allocate at least 15% of your budget to the healthcare system, and looking at the trend from 2015 to 2021,
have we had up to 12% or 10%?
So over the years, Nigeria has actually not allocated more than 6% to the health sector. So if you look at this performance, you see that it's very, very off. So those are the beginning and those are the background of why we're having these challenges. And that is for the federal government. If we also look at the state level, which ICR has done most of the investigation, the same problem also persists. Despite the fact that the federal government of Nigeria actually signed a law that they were going to commit at least 1% of their consolidated revenue fund to the basic healthcare provision fund. Basic healthcare provision fund is the allocation that's supposed to go to primary healthcare centers at the level of the local government. And the federal government committed that at least 1% of all the money they made in a year will be going to that fund. And the state also was supposed to actually contribute from their own purse to the fund.
Is it like a counterpart funding?
It's like a counterpart funding. But if you look at the trend of things, you'll see that in 2018 and 2019, the Nigerian government did not actually allocate any allocation. Did they actually allocate any amounts to that fund? The fund was suspended in 2020 by the legislature based on some malfunctioning of the operational manual of the basic healthcare provision fund. But it kick-started again in 2021. And if you also look at the provision of that fund, you see that there is actually a lot of underspending. Government not contributing their own consolidated revenue fund to basic healthcare provision fund. The state government also not fulfilling the obligation of their counterpart funding in that sector. That is the origin of this problem.
So, Ni, as important as health, and with all these projections, we know what will happen if the health system breaks down. We know the people that will suffer it. Do you think the state government really understand the importance of running a standard primary health system?
So for you to have said that it is the citizen that will suffer it, I would say that I won't use the word that would, because they're already suffering it.
All right.
And if you look at the trend of things in 2018, over 70% of Nigerians that access healthcare actually use their money to access healthcare generally. Over 70% of Nigeria. And I'm very sure, if I ask us in this room, that how many of us here patronize the public hospital here, you will see that a lower percentage of us would actually say that they use the public hospital, which means that most of the Nigerian citizens actually patronizes the private hospital, which they believe will actually giving them more proper health care. So if 70% of Nigeria are actually using their own money to purchase health care, then the question you need to ask is that when it comes to the social contract between the government and the citizen, what exactly is the government doing to fulfill those obligations? If government is not providing health care for a citizen, if they are not providing other social services, then what exactly are the citizens supposed to benefit in the government? So that's the question we should be throwing out.
Very important that we throw out these questions. But let's get to Marcus to touch more on the report in Nasarawa, because you mentioned it earlier that staff at the primary healthcare centers have to earn between 3 to 10,000. And how is this also messing things up out there, considering the fact that you said it yourself, that people are dying, that we lost 20 people in that state out of mismanagement? And also, what was the interaction with the managers, the state manager, the people that manages primary healthcare centers at the state level? What was your interaction with them?
Okay.
But before you answer that, did you at any point during your investigation interact with any doctor at the primary healthcare centers? Or were they all nurses?
I said there were no nurses.
No
So
nurses.
where you don't have nurses, how would you have doctors? And the primary health care, the National Primary Care Development Agency recommends that at every PAC, you must have 4 nurses, 4 midwives. And if they are, and you will as well have a doctor, a medical officer, with other supporting staff. So now let me come back now to the leadership of the head agencies in the state. My office wrote to the executive secretary of the State Primary Healthcare Development Agency. I took the letter to the agency. I also took the same letter to the Commissioner for Health. I interviewed the Commissioner for Health. He invited me to the state after I had concluded my investigation. He didn't respond for like 2 weeks. I'm sure he was busy. So he later invited me. Then the head of the Primary Healthcare Development Agency referred me. The first time in my life as a journalist, I've covered this health ministry for 12 years. The state Primary Healthcare Development Agency referred me to Abuja that I should go and seek permission from the National Primary Healthcare Development Agency before
they will talk to you.
Yeah, before they would talk to me. Then my office did another letter. We took it to the National Primary Healthcare Development Agency. Incidentally, executive director of National Primary Healthcare Development Agency is from Nasarawa State. There was no response. They didn't give me that permission. I kept calling the executive director in Nasarawa. I sent text messages. I sent WhatsApp messages. He was reading all the messages. You know when somebody reads your message, it shows blue, those 2 marks. He kept reading. When I did the report and published, he read it, he did not comment.
You are saying that after your report,
yes,
after all said and done,
yes,
no reaction?
No reaction. Before the publication, I think before we published that story, I think I did that investigation for almost three months or 2 months before we eventually published the story. There was no response. Even after the story was published, I sent to him so that he could read the position of his state. So now, coming back now to the feelings of the workers. There was a particular facility at Agade PAC. A pregnant woman was about to put to bed. She came to the facility at 3 p.m. and met only one male community health extension worker. That guy joined about 2 months before that time. Just joined the facility. So the woman now said, no, since you are the only man here, I cannot allow only you to attend to me. You understand?
Yes.
The woman went back home. It was the man himself that spoke with me. The woman went back home, gave birth through the support of the women around, and the baby died. So you can imagine if that woman had given birth at the health facility, if there were people to attend to her. At that facility, there were 2 women shields, we call them shields, community extension workers. So they are close. They are closed before 3 p.m. And what I also found out in Nasarawa was that in health facility where the basic care provision fund services are rendered, the staff stay till around 5 p.m. before they close. But where in others, they close 2 p.m. They are already.
Okay, Marcus, let me quickly ask you this before we open the phone lines. You have established that there's poor staffing in the primary healthcare centers. Did you at any point find out if these pregnant women enjoy the services of traditional birth attendants as a result of the understaffing at the PHCs?
Where you don't have option, when the preferable is not available, the available becomes preferable.
The preferable. Anyway, I know that this conversation, this issue concerns us all, and it's a good place, Adobe, to also bring in our listener to join us to have their take and their say on this issue. This program is interactive. The WhatsApp phone line to send your messages 09022656167. That is 09022656167. What is your impression of our primary healthcare centers when you try assessing them? Do you see enough health workers out there? We want you to call in and share your experience with us. What do you think must be done to improve the quality and the number of health workers in the primary healthcare centers across Nigeria? What do you think also must be done for Nigerians to start getting the right value for the money spent on primary healthcare around the country? Let me quickly get to Olani. What do you think is the level of incentivization needed to encourage people to work in primary healthcare centers in the rural communities, given the narratives Marcus painted? He said that people are not even coming around. People are running away from living in those communities because of the conditions. How can we encourage people to work in those communities?
Okay, so let me quickly read this. We have a message on Facebook from Iyangbe, thank God, and he said the poor healthcare challenge in public hospitals is as a result of the bad system. Once you have a dilapidated house, there is no need to ask why the bathroom is dirty. From top to bottom, same story. How will you get solution when the head do not even trust nor care about the issues? Right now, Mr. President is out to London for medical treatment. Does it mean 7 years of Buhari, he cannot build one standard hospital from top to bottom? No one bother how to handle it. Okay, thank you so much. Thank God.
All right, let's quickly see who is here.
Okay, I just want to mention that thank God who said that the president did not build a hospital. It is not the responsibility of the president to actually do that. That is why we have the Minister of Education. When you get to the states, we have commissioners for health. We have the National Primary Healthcare Development Agency and all of that to work on some of these issues. The president must not necessarily do everything.
I'm sure he's doing what he can do, but whether his best is good enough is up to the citizens to say. But let's take this call before we get to... Okay, we missed that. Let me get back to Nii, because I was talking to you about incentivization and how can we encourage people to go to these rural areas, rural communities, and work is becoming a big problem. How can we encourage people in that respect?
Yes, so based on findings and based on what I've seen, and I think I've been able to engage the national president of Midwife Association in the States. And some of the things that they mentioned, and which I was also, talked about, was people personally actually running away from these primary health care centers. So what could be the reason of some of these things? So let's take for instance, and I think she also mentioned that if an NYSC graduate finished serving and you got a job at the primary health care center, and what they are offering you, what they give them is 30 or 40,000. So you need to ask yourself is that in this age or in 2021, a graduate that just finished NYSC is being offered 30 or 40,000, either to serve as a laboratory assistant, either to serve as a nurse, or either to serve as a doctor. So that's very, very helpful, and I don't think it should be heard anywhere in a very developed or in every civilized society. And the second thing, and the wave that's actually going on everywhere, the jackpot wave, everyone leaving and to seek greener pasture somewhere else. So you see some of these medical personnel actually leaving the country, because government is not actually doing what it's supposed to do in terms of remuneration, in terms of welfare, and you see some of these challenges and some of these gaps actually happening at every level. So I would say it's not only at the primary health care level, even from the tertiary and also at the secondary facilities. Some of these problems actually emanate. And what can government do in any of these things? So one of the challenges and one of the things we have identified is that states, for instance, they are supposed to contribute 25% of fund to that basic healthcare provision fund. Federal government is supposed to contribute 1% of consolidated revenue fund. And like I said earlier, there has been gaps in this. Government has not been performing its responsibility. Some states have not been, contributing their fund to that post. And primary healthcare is actually being neglected. It's the people actually going to the secondary facility or the tertiary hospital, giving pressure on the tertiary or the secondary. You see, most people go to the general hospital, they go to the teaching hospital, because they feel that there is no facility at the primary health care level, there is no personnel to attend to them. And let me tell you, the primary health care center is actually the closest to the people because it's actually at the grassroots.
Yes. And
with over 20,000 primary health care systems in Nigeria, and people are not accessing this facility. Is what we should actually be thinking about or fixing, because we know that this is actually the one that is closer to the people. So what should governments do? Take health as priority. Allocate enough revenue, allocate enough resources to primary health care centers. It's not even about allocation. Sometimes when you allocate, you don't even spend it. And at the end of the year. So it's not just about allocation. Spend what you have allocated. It's not just about carrying over what you allocated this year to next year. So after we've seen proper allocation, let me just conclude. After we've seen proper allocation to the healthcare system, we should also see proper spending. There shouldn't be gaps between what was allocated and what was spent.
Okay, thank you for that, but let me quickly respond. Earlier this year, we had the Minister of Education, and Osagi Ehanere, who said that... Minister of Health, thank you for that. That there are enough doctors on ground. This is because you mentioned that so many doctors are leaving the country. According to the minister, the system produces up to 2,000 or 3,000 doctors every year. So for the person listening that wants to contribute, I want to ask you if you actually visit the PHCs, and if you do not, what are the reasons why you do not visit the primary healthcare system?
All right, somebody's here.
Hello?
Yes, your name and where? Hello, your name and where you're calling from?
My name is Adonijay Isaac Farrow. I am calling from Bubuku PHC, located in Tegui, Gentlemen.
Okay.
The situation is not different. In fact, that of Bubuku PHC is so pathetic that they have just 1 and 2 nurses, no midwife. There are no volunteers. How do we improve healthcare treatment? How will it get to the reach of the poor? It is unfortunate. 30 PAC and Bubuku PAC is nothing to write home about. No resident doctor, no extension worker, no midwife, just 2 nurses.
Are you talking from a personal experience? Yeah. Okay. Absolutely despicable.
Taiwo, did you say 1 staff attending to over how many mothers? The number? 30 mothers.
40.
Okay, Taiwo, thank you so much for your submission. Thank you so much. We'd like to...
Sorry,
Okay, go ahead.
You will know for that person calling out, this is almost 11 a.m. The patronage, the level of the population of PAC by this time will be reducing at this time. So if it were to be around 9, 10 now, you know that somebody attending to 30 now will be attending to almost 60 people at that time.
So I just want to jump in on that based on what she has mentioned, and she said the Minister of Health said we have enough doctors. I think this is an answer to it. The person just called, which actually contradicts what the minister said.
So the reality is
speaks for itself. It's not just
different
about,
from what the minister is saying.
You see, the reality, somebody just spoke now based on what is currently happening. And if you see that there are one person attending to 30 mothers, like I said, there will not be pressure on the secondary facility. So if you go there today, you go tomorrow, you go next, and nobody attended to you, what you have to do is go to the general hospital or you go to the teaching hospital. But how many people could afford those teaching and secondary facilities?
Very big question. Let's see who is here.
Hello?
All right, Angela, let's hear you. Where are you calling from first?
I'm calling from Manpower.
Okay. Talk to us about your experience.
I don't know, it's just because when I was in school, I watched my classmate die flat in a primary health center. So there was no doctor to attend to her. She had an accident, right? I watched him there. So we couldn't even enter the shower station. We didn't even know how to do it. We didn't resuscitate the guy. And there was very much that I didn't doctor. Because there was no doctor. It's kind of the stress we have to go through. It connected either from where we were, we have to go to the next hospital, and the distance is very far. That is what they look at, right? That's the side. Another camera thing is that on several occasions, I went to my own school there. I should have really picked it. It should be the one with that paracetamol, counting paracetamol, the counting of the heart. I don't understand. Which still counts paracetamol by this time? So the thing is that, how do you know how to even get well with counting paracetamol? And then nothing more. So they still have to take treatment. I don't know that they go strong enough. This is very interesting. And then the security person there issues
The
birth certificate.
birth certificates.
Yes, the security person at the PHC issues birth certificate. If you want to look at where it came from.
We are particularly in Kubwa. Oh, Angela dropped off there. I wanted to find out the particular PSC in Kubwa.
The security man should not issue birth certificate. It is the job of the NPC, that's the National Population Commission, birth registrars to be precise, that issues birth certificates. But it's unfortunate that she lost a friend or is a relative as a result of the lack of facilities and then medication at the primary healthcare center.
But let's get to Marcus, because yes, you interacted with people. What were the people saying? Because in most cases, we tend to forget about citizen ownership of primary healthcare centers, they have their own role to play. What was their interaction like? And how aware are the people you interacted with out there about their roles?
Yeah, thank you. Like in Nasarawa, the major role, there are ward committees, ward development committees. But from what we found out, we discovered that the head of the facility, like the officer in charge, has virtually total control on the usage of the fund. That's in Nasarawa. But that officer in charge is appointed from the community where the PAC is located. So that's what we found out. But like in the...
Sorry, the Community Development Committee, the
Yes.
Ward Development Committee,
Yes.
well, are they functional? Because if they function, it will add to the betterment of the primary health care in their community. Are they were they functional?
That is more functional in Ogun State. It's
Okay.
more functional in Ogun State than in Nasarawa.
Okay.
Like in Ogun and Anambra, we discovered that in one of our stories in Ogun State, we discovered that the head of the PAC cannot get the fund without the chairman of the World Development Committee signing the check. So the fact that has created a gap. There have been a lot of issues.
So wranglings.
There have been a lot of wranglings because the chairman of the World Development Committee may refuse to sign the check. The money will be there in the bank for the PAC to use. But if the head of the World Development Committee refuses to sign, the PAC cannot get it. But in Nasarawa, it's not like that. Money comes directly. I saw some of the payments made.
So why is that different?
So it depends on state policy. There is something. I just see. Don't let us only focus on the problems. Do you understand? There are a lot of good things about this basic care provision fund.
Okay.
So for me, if government really wants to make that work, the use of staffing should really be encouraged. The governor of Ogun State, the commissioner for health in Ogun State said they were only able to engage 67 midwives because there were nobody to be employed. There were no people to be employed. In fact, let me even
So people are running away from taking up the job.
That's a lie. That is a lie. That cannot be true. There are a lot of midwives graduates in every local government, in every state. So there is no how a state can claim that there are no midwives to be employed. It can't happen.
But when you want to pay them between 3 to 10,000 or 30,000, you have just said that Olani, you said so many people would not want to take that up.
I think in Ogun, some earn 30,000. No, that's in Anambra.
With our current economic reality.
Yes, Anambra pays 30. But for supporting staff, for those that are volunteering, I don't know the actual amount. I didn't the story.
Even somebody that volunteer still eat
those that
food.
volunteer in Ogun are paid 15,000 naira.
All right. With that in mind, let's quickly run to Olani too. You know, a lot has been said, and if you look at it, citizens are already giving up on primary healthcare centers. And do we have a call? No.
Okay, no.
Okay. So, but you know, because of the service delivery out there, citizens are giving up. How do you think this lost trust in our healthcare system can be restored? And also, you can join it up with your advice to Nigerians
and how they can demand for accountability.
Demand for accountability.
So I think
if you can do that in 1 minute, please.
Okay, so I think most of the challenges we have in Nigeria is that most people have given up, which is normal. We are all human beings, and why this? Because there's actually been a trend of government failure to address the needs of the people. So when you ask an ordinary citizen on the road and you ask them questions like what do you know about allocations to this social community, they will tell you that it's not my business. What do I need it for? Because people have lost hope in government. So what government needs to do is to build that trust back. If you go to the budget and you see the allocation to the presidential village center, you'll be shocked. We have allocations, big ones to those ones, and when it comes to implementation, you see that funds were disbursed to them. But when it comes to the facility that's supposed to address the needs of the people, you see gaps in there. So government needs to build that trust back. And government, we've always been saying this, and I think I have to emphasize again. Government officials also need to use some of these facilities to know how the people feel. Because if you don't use some of these facilities, how do you know, the problems and the challenges that people are facing? So people are facing these challenges everywhere. It's not only in the states we have mentioned, it's all 36 states and even in the federal capital.
All right, let's get this last person.
My name is Daniel.
Daniel.
Let's hear you in 1 minute. Where are you calling us from?
I'm calling from Life Camp. We are talking about issue of primary health care.
Yes.
Yeah, you see, because of the system of practice in this part of the world, primary health care is supposed to be for the local government to take care of, but because of the government doesn't take care of the local government, some of the state even have local governments. You understand? If the local government should take care of the primary health care, I think it should be more better and more standard, because if the primary health care is very close to the people, and it should be taken care of by local government, so that let's see the efficiency of primary health care.
Okay.
Federal government cannot be in Abuja controlling primary health care in my village.
Oh.
It's not done that way.
Okay, I will have to also clarify that the local government take care of primary health care, but we have a national primary health care development authority agency out there. As we wrap up, Marcus, in 1 minute or 30 seconds, what would be your advice? You've done your investigation, nothing has come out of it. What are you telling the government? What is the advice to citizens? Well, put it together in 30 seconds for us, or 1 minute.
I actually say this from my experience in Nasarawa. I love the enrollment method of Nasarawa into the basic care provision fund. I will also want other states to take a cue from that, despite all the challenges that I mentioned. The state has its own enrollees that it funds. The state health insurance agency enrolls those people. And currently they have 10,000 people, according to the executive secretary of that agency. While the federal government has also provided fund for 38,000.
Okay.
So the state 10,000, the federal government 28,000, federal government 28,000, state 10,000. So altogether 38,000. So I also want other states, because you cannot grow primary health care without this basic care, because it is an initiative that is working.
Okay.
In every ward now, like in Nasarawa, you have PAC in the ward, and there is one of them that is funded with the basic care that's provided the services. So if in the next 10 years, if all those PACs can also be getting this fund, I believe this will, and the state should not be depending on the volunteer and contracted staff like Nasarawa.
They should recruit.
They should recruit and pay.
All right. Thank you so much, and it's a good place to leave it. States should take a cue from Nasarawa State. Adobe, we have to round up this program.
Yes, it's been a robust conversation, but believe me, we will still have more of this conversation going forward. All the details of our reports and interviews, visit our website, www.primorg.org, to get all the information about Primorg.
And you can watch our videos on Primorg TV, our YouTube channel. Please subscribe to get reminders when we have a new post. We appreciate our guests, investigative journalist with the International Center for Investigative Reporting, ICIR, Marcus Fatumole. Thank you for coming.
It's a pleasure. Thank you.
We also, our sincere thanks also goes to a program officer at International Budget Partnership, Olaniyi Olaleye. Thank you for joining us this morning.
Thank you for having me.
Public Conscience has the support of John D. and Catherine T. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another interesting episode of Public Conscience. And remember to follow us on Facebook, Twitter, and Instagram at Official Primorg. I am Adaobi Obiabumo.
And remember that birth registration and birth certificate are both free if your child is under 18. Help stop the corruption in birth registration, and do not pay for birth certificate. Also remember that you can give us information or hint about corrupt acts through our phone at 09022656167 or info@primorg.org. I am Chidozie Obonnaya. Stay safe.